Today I'm going to talk to you about something which has been bothering society for some time. That is people having heart attacks following sudden aggressive bouts of exercise, or people sometimes having a sudden cardiac death following sudden bouts of exercise. We all know, and it's medically proven, that modest amount of exercise is extremely good for cardiac health. It is in fact recommended in all recommendations all over the world. The problem is what happens when we indulge in sudden aggressive bouts of exercise, particularly bouts of exercise which involve lifting of weights or muscle strengthening in an unaccustomed kind of a way. What happens during these bouts of exercise is that we all understand that exercise is essentially an adrenergic form of body metabolism, which means that adrenergic hormones get secreted during exercise, which lead to an increase in heart rate, which lead to an increase in blood pressure. Additionally, when we indulge in muscle strengthening or weightlifting kind of exercises, we also cause a shear stress on the blood vessels of the body, including blood vessels of the heart, which can sometimes tear, which is in medical language called coronary dissections, which can make one more prone to have heart attacks. How do we diagnose, or how do we kind of identify these people who are more prone to get cardiac events? Well, the symptoms in these patients are essentially the same as symptoms that happen in other normal individuals. If you have undue chest discomfort, if you have undue breathlessness, if you take a long time to recover after an exercise schedule, if you have undue fatigue, or if you have excessive marked sweating during exercise, you must not take it lightly, and you must get yourself evaluated before you embark on an exercise schedule which is aggressive in nature, or which is guided by an instructor. What are the things which we commonly do wrongly when we indulge on an exercise schedule? Well, this is more of commonsensical than anything else. Most of us who are involved in jobs, in India particularly, till you're about say 35-40 years of age, we are chasing our academic and career pursuits. So at 40, when we suddenly decide that we want to run a half marathon, or we want to get some muscle on our body, that's the time that problem starts. We try to indulge in an exercise schedule mimicking others, aping others, not realizing that all bodies are not the same. So the first error that we often do is that we embark on an over-ambitious schedule of exercise without preparing for it. What one needs to understand is that any form of exercise needs preparatory time. It needs to be gradually increased. It cannot be done very abruptly. And therefore, we must give our body at least 6 months to 1 year before we reach a target. There's no point of trying to run a half marathon in November by starting the preparation in September. You're obviously overstressing your body, and one among the many who prepare for it may actually have an adverse outcome. The second thing is follow general schedules of exercise. That is, try and exercise on an empty stomach. Do not try and exercise after you've had a late evening, after you've had indulged in heavy alcohol consumption. So try and reduce your exercise during times when your body is not adequately rested, or when your body is not adequately prepared. There is also a bit of myth about early morning exercise schedules. A lot of people tend to feel that we must exercise early morning because that's the best form of, or the best time of exercise. Well, each individual is built differently. So there is no fixed time for exercise schedules. You could do it in the morning, you could do it in the evening, and in winter months you could also do it in the afternoons, provided your time schedule permits. So do not be fixed on early morning exercises. Actually, people who exercise very early in the morning may be slightly more prone to heart problems because, one, the environment is heavy, the air tends to be more heavy, and secondly, even within the body there are hormones that are secreted which make a person more prone to heart attacks early in the morning. It's a well documented fact that many cardiac events tend to happen early in the morning. Finally, how can we reduce the incidence of these events? How can we kind of bring down these events? Well, there are two suggestions that I want to make. One, which I've already spoken before, embark on this schedule in a more modest, in a more moderate manner. The second thing is, if you have a risk profile, if you're a diabetic, if you're a smoker, if you're a blood pressure patient, if you have a very strong family history of heart disease, and you're suddenly deciding to start exercising at 35 or 40 years of age, please do some kind of a basic checkup before you embark on an exercise schedule. Aim for modest gains. Do not be very ambitious. I've come across patients in practice who come and say that they want to lose 10 kilos in a month. Well, that's not desirable and that's not possible. Your body will not tolerate it, and therefore be modest. So we must understand that the operative work in the whole process of exercise and prevention of heart disease is moderate or modest. Be moderate in your exercise schedules, build it up gradually, and I'm sure you will never have a problem. Thank you for listening in. Have a great exercise schedule ahead, but a moderate exercise schedule.